My name is Els Toreele. I'm the executive director of the Access Campaign with Médecins Sans Frontières. I was with the Access Campaign also 15 years ago when we created DNDi, and I was a founding member of DNDi. And in the early days, together with my then chemist colleague Bernadette Bourdin, we have rediscovered basically fexinidazole and brought it into preclinical development as a new candidate for sleeping sickness. Scientists who were interestingly quite charmed by the fact that years after they worked on that or they published something that people associated with MSF reached out and said like, oh, can we learn more about the compounds that you were working on? And so we managed then to get samples of those compounds, if they still existed, that we then, in a collaboration with the Swiss Tropical Institute, tested for their activity against the parasites, both in a petri dish and ultimately if they were good also in the animal models, and focused a lot on trying to see whether they had this toxicity or not that we were expecting. And we were quite lucky to see that actually a number of compounds within the few hundreds, there were not many, but maybe 4 or 5 that had actually not such a toxicity. And one of them was fexinidazole, that we then uncovered that actually had been in development for in preclinical development as some broad spectrum anti-infective by Höchst, a German company that later became part of Sanofi Aventis group. We were not looking for something that was patentable. I think today, no company would ever take a drug candidate, invest money and effort into doing the full research and development if they weren't able to then, commercialize it and make a lot of money out of it. And the way they do that is by having a patent monopoly. We were not bothered by that. So we could look actually at everything that was out there, patented or not patented, it didn't matter. And actually, it was better if it's not patented, because we didn't have to negotiate access. But we looked at the whole spectrum. There were a couple of compounds that we started to look into, and basically at some point when we managed to get the files from Höchst that showed that actually a lot of work was done already. That okay, it was done in the 1970s or 80s according to old regulatory standards, but still they had actually investigated quite far. The moment we got a hold of these files, I really had this eureka moment together with Bernadette, and I think I sent an email to Bernard saying like, yes, I think we have something here. Well, I think the first lesson would be for me that to confirm that it is possible for a not-for-profit organization to develop from discovery, early preclinical, up to patient access, do the whole drug development. It is not something that only pharmaceutical companies can do, which often is a claim that you hear. So if you put the right teams together, you can actually do it, and you can actually do it for a much lesser cost than what is often claimed that it costs within pharmaceutical companies to develop a drug.